That last statement would be a lot more compelling if it wasn't all focused on fixing the mistakes of this government. Now, recently, the topic of health care continues to be a major issue for Albertans. We've learned that children and their families are showing up for surgeries at Stollery Children's Hospital only to discover that their surgery's been cancelled due to overcapacity. We've learned that hospitals in Calgary are so jam-packed that they can't treat patients in need of dire care 66 times in November alone. We've learned that the government has no problem finding $2 million for a luxury golf course, yet they can't find $17,000 to bring elevators at the Sturgeon Community Hospital up to safety code, or find $55,000 to buy a lightning rod that Misericordia needed 3 years ago. They can't even find $200,000 that Royal Alex has needed since 2010 for a fire alarm upgrade. It sounds like the PCs need a little help getting their priorities straight. And today we learned what everybody already knew, that rural Albertans don't have access to the care they need, that small towns across this province have lost their family doctors, that rural Albertans can't rely on EMS services when they need them. The PCs will tell us not to worry. They've solved the problem once again. Nothing to see here. And just like they did last year and last decade and the decade before that, but yet the problems still seem to get worse, Mr. Speaker. The PCs have failed to manage Alberta's healthcare system in the good times. They've failed to invest in crumbling hospitals. They failed to provide services. They couldn't even fix an elevator, for crying out loud. Now that the price of oil has dropped, now that budgets are tighter, does the Premier really expect Albertans to trust him to fix healthcare now?
The honourable member for Calgary Varsity.
Thank you, Mr. Speaker. In Calgary Varsity, we received